A call from parliamentarians for a robust mental health system, one that offers comprehensive support without discrimination and regardless of age or employment status. In improving access to mental health care, MPs called for a review of subsidies and insurance coverage. Jurong MP Meng raised the alarm over residents who were declined medical insurance coverage due to their mental health conditions. Now, he says that ideally they should still be covered at appropriately priced premiums.
But what we see instead is, even if someone has that additional risk from the pre-existing condition, the insurance company, more often than not, according to my residents, regards them as someone they would not want to insure at all. In short, instead of a slope of additional premiums based on incremental risk, this is one area of market failure where regulators can step in. In this case, to make sure that insurance companies make decisions which are reasonable and proportionate.
Sengkang MP Ting suggested more mental health coverage under National Savings Scheme MediSave.
I hope that the government would consider allowing the use of MediSave to access mental health services in other practice settings apart from purely psychiatric settings, particularly in the private sector. It would not be a big step to use our 3Ms framework to better improve access to mental health treatments and interventions, as MediSave is already being approved for use for mental health services at places like IMH and polyclinics.
More than 20 MPs weighed in this session with proposed solutions that ran the gamut from financial subsidies and staff welfare to closer monitoring. For children and youths, non-constituency MP Hazel Phua repeated her calls for regular assessments that can identify students who need help, as she cited the River Valley High School case from 2021 to stress the urgency in prioritising mental well-being for students. The 16-year-old attacker suffered from major depressive disorder. She says mental health assessments can be done in a similar way that academic achievements and physical fitness are tracked.
Conducting a mental health assessment each year using developed tools will help us identify students who need help and proactively reach out to them so that we can prevent such a tragic incident from happening again.
For the workplace, Labour MP Melvin Yong pressed again for a so-called right to disconnect measure, giving employees downtime to rest and recharge. He's suggesting guidelines on what such a law could mean for different sectors and occupations.
Locally, union leaders have told me that exemplary practices at the company level that provide workers with the ability to switch off after work. I'm glad that senior public sector leaders in the Ministry of Manpower and the Ministry of Health, just to name a couple of examples, have made it a point to tell staff that they do not need to feel obligated to respond to emails or work messages sent after work hours, unless it is expressly marked as urgent. We should make this workplace culture the norm rather than the exception.
A nominated MP, Keith Chua, also asked about financial support for people recovering from mental illness who are unable to return to work. This is especially for severe cases where people can be put out of work for a long time.
Can we review the provision of a disability allowance scheme where individuals who have financial difficulties during the treatment and recovery can receive adequate support until they are ready to return to earning income? The availability of some form of disability allowance extends the rehabilitation options and programs for persons in recovery.